Hi there, my name is Rebecca Williamson. I'm the publisher of Fierce Pharma, and I'm here today with Matthew Walsh, General Manager of Biopharma at iXlayer. Thank you so much for joining me.
Thanks for having me.
So to kick us off, tell me, as science becomes more specialized and markets become more competitive, how should commercial teams be adapting their product development and go-to-market strategies to meet evolving stakeholder needs?
So the traditional commercial model in pharma is really anchored in field force marketing and brand-centric marketing, which really only works if patients are actively engaged in their care and engaging clinicians. Now, the issue is many clinicians are overworked and generally hard to see, and patients we've found are actively avoiding care because it's inconvenient. So I would encourage commercial leaders to invest in programs that are breaking down the barriers for patients to engage in care so that they can get more out of those traditional tactics. And examples of some of these programs could be linking your patient awareness and patient marketing campaigns to a direct call to action to see a clinician virtually or get a diagnostic test to be more proactive about your health and engage with the healthcare system.
So tell me, how do DTP programs empower patients to take a more active role in their healthcare, and what are some examples of where it has been successful?
To me, DTP programs are all about making patients more proactive about their health. And an example I can think of is a type 1 diabetes program that we made. So for those who don't know, type 1 diabetes is a condition that doesn't really have any signs or symptoms until you have a life-threatening event called diabetic ketoacidosis, where you wind up in the hospital, and then thereafter you have to basically do insulin to control your blood sugar for the rest of your life. Now, there are blood biomarkers that you can test to understand your risk of developing type 1 diabetes, and this actually lacks some awareness in the medical community. So what we did was we created a program that linked from the client's awareness campaign, where a patient could go and request screening for themselves or their child to determine how much at risk they were of the condition, especially if they had a family history of diabetes or of an autoimmune condition. And we found that about 15% of those requesting tests were actually at risk, and we were able to connect them with a clinician within 12 hours. So this is a great example of how we can allow patients to be much more proactive about their health, even when there's lacking in awareness in the medical community.
Wow, that's right. So tell me, how do you incorporate your understanding of patient needs across different demographics and health conditions when designing a client solution?
So whenever we create a DTP program, we're always taking into account patient needs and the needs of the specific therapeutic area. An example I can think of there is in dermatology. So in chronic dermatological conditions, often patients are treating with earlier line treatments, and they kind of get stuck there without being able to escalate even when their condition is not controlled. And so what we did was we created a program where patients could get access to experts who had comfort prescribing advanced therapies. And within 3 days, they could be assessed for what is the severity of their condition, how well controlled it is, and are they appropriate for advanced treatments, so that they can really take control of their health and get access to the medications they need. And when you compare that to the average wait time for a dermatologist of about 26 days, these programs are really beneficial to helping patients treat their conditions appropriately.
Now, you recently conducted some research among pharma marketers about DTP. Tell me, what did you find?
So we conducted a survey among pharma marketers on their attitudes around DTP programs. We found that over 75% of pharma marketers are either active with the DTP program or considering launching one in the next 12 months, which to me is an astounding number considering we've really only been talking about this for the last 12 to 18 months or so. And especially considering the pace with which pharma moves, this has gone very, very quickly. And what really stood out was marketers are doing this because they want to improve the patient experience. Now, the biggest challenge that they faced with launching these programs was compliance. So I think it's really important when a marketer is going to embark on a program like this, that they find a partner and a vendor that is really well versed in the challenges so the marketers can focus on improving the patient experience and letting the vendor worry about the compliance considerations so that they don't have to get bogged down by those details.
So final question for you. If there's one guiding principle you believe every commercialization leader should embrace to deliver both business and patient value, what would it be?
I think the guiding principle is keep it simple, make it easy. Simple and easy are not the words you typically think of when you think of pharma and healthcare. Often you think of complex and complicated and burdensome and frustrating. But patients are used to very easy things in other parts of their life. We have digital solutions where you can shop online, you can order takeout with a click of a button. I think it's very important to think about how to make these solutions in pharma and healthcare just as easy as patients are used to outside in the rest of their life, and really raise the bar for healthcare so that these solutions are easy for them and they can really manage their health effectively.
Feels like a great place to stop. Thank you so much for joining me today. I appreciate the conversation.